Maintenance therapy following autologous stem cell transplantation for upfront treatment of multiple myeloma remains a standard. For example, lenalidomide is the best treatment we have for maintenance therapy. Other studies have looked at bortezomib and bortezomib alone or in combination with other drugs. And the major concern with long-term bortezomib use is tolerability because of the neuropathy signal that occurs with prolonged use. Some patients actually do tolerate it for an extended period of time, but a lot don't. And so len has become the standard. There was a recent study, the tourmaline study, which looked at ixazomib for 2 years versus placebo. And that showed a benefit. I was a little surprised that it was relatively modest, just a few months. And whereas the lenalidomide studies have been a couple of years benefit. So it remains to be seen whether or not they truncated the study too soon. They only went to 2 years. It brings up the point of lenalidomide or other agents until progression if the patient is tolerating it. The major reason for this is that multiple myeloma remains an incurable disease, and so long-term disease-free control is paramount. And until we can understand the biology better of the disease and target the disease better, it remains the standard to consider some type of long-term therapy to control disease and prevent disease progression. The current practice in the US is to utilize maintenance therapy after autologous stem cell transplant. For patients who are non-transplant eligible, there's no clear standard. We are moving towards prolonged therapy where you are giving the patient something they will tolerate. So there's not treatment fatigue, because the major issue is patients don't like coming in a lot to get therapy. So the more you can deliver something that's preferably oral, where they don't have to come in too often, perhaps monthly to check a CBC, a complete blood count to make sure their counts are okay. That appears to be the standard, and especially after an auto transplant. We are concerned about second cancers, so it's something we are constantly studying, and we don't yet know which patients will develop a second cancer. We do know that the risk of a second cancer is still outweighed by the benefit of maintenance therapy with lenalidomide because of the risk of progression and death, which is higher with patients who don't receive lenalidomide maintenance.